I'd like to welcome you to the second episode of Own Your Spine podcast. My name is Dr. Christopher Notley. I'm a chiropractor and athletic therapist. And in this podcast, I'd like to introduce myself to you and help you get to know me a little bit better. This is my backstory. So, when I was in grade 8, I started to get interested in weight training, obviously, using weights to develop muscle. Uh, Maybe that would attract the girls. I don't know. But I developed a great interest in it, to the point where I had hundreds of muscle and fitness magazines and flex magazines uh, and Muscle Mag International, a pile of them that I would have. And so I really found an interest in building muscle, getting strong, and seeing the relationship between that and athleticism. Now, at the same time, I also realized, and I find this profound at that age, to be thinking about my future and what would happen when I'm old. Now, back then, I'm pretty sure old was about 60 years old. I realize now that's not really old. Um, I'm nearing in on that, but I realized that I didn't want to be in a situation in my life when I was older to need to be in a wheelchair, to need assistance getting up off the floor or getting out of a chair or being winded walking up and down stairs. And this is where I found that weight training and exercise was more important. And so that interest in developing and getting better, stronger, faster was kind of my thought process at that point in time. Also, getting faster and being able to change directions quickly was developed very well because my brother used to chase me, and so I had to be faster than him. He was older than me. I had to be faster than him. I had to be able to dodge and change directions quickly, and I think this really, allowed me to get better at sports, and, I was involved in sports. I was lucky to be in a small school where I was able to play for, even though I'm 5'4", being able to play basketball and volleyball. I got into track and field. I learned a little bit about rowing. Ultimately, as I became an adult, I started to get into ultimate frisbee. So being active was something that's been part of my life, for a large portion of my life. As we fast forward to high school, I still have that interest in weight training, and I was in sports as well, and we had an assignment in grade 12, and we had to decide what we were gonna do once we graduated from high school. I wasn't quite sure what I wanted to do. I was good at math, I was good at physics, I liked that stuff came natural to me, so I thought maybe I could be an engineer, but I also had this interest in weight training and to help better people. And at that point in time, and I don't remember where athletic therapy came from, where I heard about it, but that's what I wanted to do. I wanted to help get people better, not only better from their injury, but better beyond where they were, at the point of their injury. And that's where weight training, you could take them and make them stronger than they were. And so I had to do an assignment where I followed a student around, and I also had another part of that assignment where I had to follow a professional around. Well, you at that point in time, when you looked at the calendar for the University of Manitoba, there was no such thing as athletic therapy. You couldn't find it in the calendar. Um, and so instead of doing that, I followed a physiotherapy student around at the Health Sciences Center. Now, it wasn't quite what could see myself doing. uh, Taking care of people who were stroke survivors, burn survivors, amputees, paraplegics, and people with other musculoskeletal injuries. Also, those who have respiratory issues, and a lot of that really didn't intrigue me. Um, at that point in time, I felt, "Am I going to get these people better than where they were before their problem. And in many cases, I realized that the likelihood the answer was no. And that at that point in time stressed me. And I thought, you know what, this is probably going to burn me out very quickly. Fast forward a month or two, and I learned about an athletic therapist who was actually a friend of the family from from Transcona, and he was working at the Pan Am Clinic. And I went and visited him, and I walk into his office and into the clinic, and there's some treatment tables, and there's all the weights and the machines for weightlifting machines and all that. And at that point, I'm like, this is what I want to be part of. I got to meet him, and then I also got to learn a little bit more about athletic therapy, and I went downstairs and met Mary Kate Turner and Stan Zumlak, and I got to see the bracing and casting part of things, something I had no idea that we did. And this was really intriguing me. This definitely felt like something that I could do for the rest of my life. I graduate from high school, not 100% certain what I'm going to do. But I did discover that there was an athletic therapy program, but it was kind of an internship, and it wasn't a developed program. There was no name of athletic therapy in the calendar, but it was being done at the U of M. But I went on and went to my first year of university, and I went to the Faculty of Science. Not quite sure which way I'd go. Would I go into athletic therapy, or would I actually become an engineer because of my interest in math and physics? As I went through my first year of university, taking a whole bunch of science courses, about 3/4 of the way through, I was sitting in physics class, and I thought, "I don't wanna be in a lab. I don't wanna be stuck behind a desk. That's not for me." And so I dropped the idea of engineering, and I went into the Faculty of Physical Education. Went through the Faculty of Physical Education, graduated, one of the top of my class, won a few awards. But in the last year of the physical education degree, which is now called kinesiology, I got into the internship for athletic therapy. Uh, Glenn Bergeron was the one who interviewed me. At that point in time, he was going to be the one that would be one of our main mentors, and he taught me anatomy when I was in phys ed. And I got into the program in my last year. Ultimately, Glenn decided to move over to the U of W, but because the U of M was still close to home, I stayed at the U of M. And the internship really wasn't a um, course-based internship. You were hands-on, treating athletes, treating the general public in the clinic. And another side of it that I wasn't aware of, and it was working on the field with teams. Now that's not quite my environment. I don't feel comfortable in that environment. I felt far more comfortable in the clinic where there were tables and the weights and therabands and doing the therapy side of things. But I did get a lot of experience of working with different athletes. I worked with the university wrestling team, which was a fabulous experience. I worked with the women's volleyball team, and I also worked with the football team. And that helped me understand different types of sports. Um, we had, football was more of a collision sport. So wrestling was more of a combative sport, and then volleyball was a team sport that was probably more of a sometimes acute injuries, but more of a repetitive strain type injury sport to deal with. During that time, I took some more courses. I took another anatomy course through the Department of Anatomy at the Health Sciences Center. This was because at that point in time, the university was going to actually have an athletic therapy stream, and they wanted to know uh, which anatomy would be good for our students. So I volunteered to take that course, furthering my understanding of anatomy from the anatomy that I learned when I was in the faculty of physical education. I also took osteology, which is a study of bones. At one point in time, I could look at a fragment of the skull and tell you which bone it was from, what that hole was that was there, in that fragment, and I could tell you what side it was. I could even do that with the teeth. I could tell you whether they were top or bottom or left or right. I haven't done that in a long time, so I don't know it as well anymore. And I also took psychology along with nutrition. I finished off my finished off my athletic therapy and certified in 2000, and almost immediately started working. And my first job was actually teaching. I was teaching at the Professional Institute of Massage Therapy, and I was teaching anatomy. Uh, I really enjoy anatomy. I enjoy not only just the how well put together our body is, and how well supported our joints are, especially our spine, which has a lot of ligaments holding things together and a lot of muscles holding it together as well. It's a really strong, rigid, strong, not rigid, a strong, well supported structure. Um, at the same time, I also developed, or sorry, at the same time, I started to work at a clinic in Selkirk, and then added on 2 more clinics in Winnipeg. Those 2 clinics in Winnipeg were owned by chiropractors. Now, at one point in time, I remember actually saying, You don't need to go see a chiropractor. The reason the joint isn't moving well is because the muscle's a problem.' I said this, I say it honestly to my patients. This is what I thought at that point in time. Fast forward a little bit, and now I'm working at these clinics, and I'm working on a patient, and I'm trying to massage out, some tightness in their neck. I'm working on it, and I'm not getting anywhere. This neck is not loosening up at all. So I went over to the chiropractor and I said, "Look, I've got this patient, gave them their history, what I was finding." And they came in and they assessed the person and they adjust the neck. And so right after that, I sat down and I rechecked those muscles that were tight and everything was loose. And I remember thinking, I can do that. Like at that point in time, like that looks easy. I can do that. And I realized also at that time that, wow, this is a tool that I don't have that will perfectly fit into my form of care at that time. And my form of care at that time was manual therapy, doing massage, stretching, giving people exercises, using some modalities as well, and adding in this manipulation hit an area that I really didn't know how to treat well. Uh, and it was a tool that if I got a toolbox, I want to have as many tools as I can so I can help as many people as I can. And learning how to manipulate the spine was something I didn't have, so I needed to learn it. The chiropractors I was working with at the time graduated from Northwestern in Minneapolis, and so that was the closest school for me. I'm a homebody. Winnipeg's my home. Family's here. My friends were here. Practice was there, and so I decided that I'd go back. I'd go back to school and become a chiropractor. 2005, after getting some more continuing ed credits, that not continuing ed credits, some more courses that were required for my required to get into the program. They were my prerequisites. I My wife and I, after getting married 2 months before, we hopped in the car, had a 14 foot cube truck with all of our belongings, and we moved to Minneapolis. While in Minneapolis, I went through my education. I learned more anatomy, but also more of how to assess not just the muscles and joints, but we also learned how to assess the eyes, ears, nose, throat, chest, abdomen, heart. We learned how to do um, breast exams and prostate exams, and obviously some of these things I can't do in practice in Winnipeg, but it was a requirement that we learned how to do it while we were in school. So it's far more than what I had just learned in athletic therapy. I ultimately graduated summa cum laude and at the top of my class, so I was the valedictorian of my class. I wasn't trying to achieve this. I just felt that it was important to do my best at my education so that when I left and came back to Winnipeg, that I would that I would be able to provide the best care for my patients. In our last year of the chiropractic program, we do an externship. Uh, it's an opportunity to take the skills that we learned during our internships and go to a clinic outside of the school, a clinic maybe even outside of the state. I decided to go back to Winnipeg and did a internship with actually the chiropractors that I work with right now at Precision Movement and Therapies. At that point in time, the clinic was called Downtown Chiropractic, and it had been there for years, even prior to the chiropractors who owned it at the time. I did that 3 months of that, and they asked me to if I wanted to work there, and so they had about half time that I could work there, and Dr. Gelly at Gelly Chiropractic, whom I had actually shadowed a little bit during that internship, he called me around the same time and said, "I know that you want to work in St. Patel. Do you still want to do that?" And his associate that had been working with him was retiring, and so I now had two clinics to work at. And for the last 14 years, I have been working with the same doctors and continuing to learn. I've acquired the ability to provide acupuncture to my patients. I've learned other soft tissue techniques like active release technique and fascial manipulation. I've learned other things like the functional movement screen and the functional conditioning or uh, functional release conditioning. I think that's what it's called. Can't remember at the moment. Uh, Furthering my understanding of how to take care of patients. So there you have it. That's me in a nutshell. Um, I think my teaching helped me become a better educator to my patients. I think becoming an athletic therapist allowed me to be a more rounded chiropractor, and vice versa. Uh, Becoming a chiropractor made me kind of a well-rounded athletic therapist. So in my practice, I treat a lot of people for neck pain, back pain, headaches because people see me as a chiropractor. I also do treat ankles, knees, hips, wrists, elbows, shoulders, TMJ, uh, providing a more well-rounded approach to better my patients.